like, "You mean it's like a vicious cycle?" And I was like, "Yes." And they're like, "Oh."
Exactly.
So that's interesting.
Exactly. So say that again. They're on an SSNR. Is that what you said? A serotonin
S
norepinephrine reuptake inhibitor?
Yeah, SSNRI.
Okay, super. Yes, and what you're pointing out is, yes, when the pathways are interrupted, pharmaceutical drugs can cause some side effects, increase some inflammation, which further interrupt the serotonin pathways and requires you to take more and more of the drug. So the vicious cycle. Any other things happening in the case worlds, different patient outcomes?
I do have a question on eczema, and the gut. And from what I had learned, I thought that the gut had a lot to do with eczema. If the gut's messed up, skin conditions can pop up.
Mm-hmm.
Can you talk to me a little bit about that?
Yeah, you know, the couple of points to look at here, that wherever a person's weak link is in their detoxification pathways, many of these recycling toxins that we talked about, um, secondary bile salts being unconjugated and recycling toxins, lipopolysaccharide being released from the cell wall of certain bacteria, uh, causing an extreme endotoxin, exotoxins from um, Clostridia, from Candida, and the body has to deal with all of these toxins. And if there is a weak link in how this individual processes these toxins, now normally they're supposed to be, neutralized by the immune system, carried off through the lymphatics, and then, go to the liver, um, or to the kidneys, whether it's, going to be um, hydrophilic or um, so forth. And that's the way normally the toxins are to be removed. But if the person's liver or kidneys aren't functioning properly, their P450 systems are not working the way they should, then very often the body will shuttle these toxins off through the skin. And that's where we'll see a lot of acne and psoriasis and eczema, um, you know. And so some people will say, well, that's related to the liver. Well, yes, it is, because the liver's been overwhelmed, and then you're going to see them on the skin. Or they'll say it's related to the gut, and yes, it is. It's because the toxins originally, coming from the gut, or poor lymphatics. All of those are true because they're all involved. And so when we've got some of our clinical studies, currently there's one at UC Davis that is dealing with, the dermatology and some of the mechanisms that they're trying to elucidate, specifically in the skin, that they find that taking the spores helps the body hydrate the skin better. And we also find that there's less acne blemishes, less psoriasis, and less eczema. So we're seeing that things are moving in the right direction by starting with the gut and supporting the liver and the kidneys and the other detoxification pathways. So that was a long answer. Did it get to the point of what you were looking for?
Yes, actually, it gave me a whole lot more than what I had already had prepared, because I'm going to be talking with somebody about the eczema and the link between the gut. So that does help.
Super, super. Any other um, patient interactions, any die-off reactions, any unique off-label uses of the products?
So far, I think the most unique one is a patient who was on HU58 working up to the megaspore eventually. They moved up to the restore floor, and then stool size increased greatly such that it was very hard to come out
Hmm.
and constipated. And then when they would stop taking it, it would go away and normal stool size occurred. And then um, the patient was like, all right, I can't keep doing this. I don't know if the stool's actually going to come out. I can't walk when it happens. Um, so my idea was to either go to Megaspore or back to HU58. So she had decided to go back to the HU58 and go with something like 3 a day, like work up to 3 a day or something, and see if it can work out some of the fungus stuff that way, because
Hmm.
the restore floor was too much for her.
Right, and this is where we see the individuality of different people, um, how there is not one person who's going to react the same with these products. And uh, what we have to realize is, if they are prone to certain GI symptoms, then that's even more of an attention we need to give to them. For instance, everyone knows constipation is extremely uncomfortable. We want to avoid it at all costs. If the person, and I would say a lot of women will suffer with this, and we know there's several causes. Um, when Even when you're making a good change to the gut microbiome, some negative things can happen. This is observed across the board. Any product that is going to make a difference has to go through this transition phase. So when you're considering constipation, here's some things to look at. We know that when we're affecting of a change, lipopolysaccharide can be released and shut down the bowels. We know that um, the stool size and the bulking will change because the body is working more effectively. But if you get those two happening at the same time, a large stool that's shut down in constipation, then you're going to have a really unhappy patient. So going at it slow enough to where you can work with them on all of the other aspects of their bowel. The bowel is a muscle. It has to peristalt. It has to be conditioned. It has to have the right fiber. It has to have the right fluid, well hydrated. It needs to be exercised. So we've got to look at all the other aspects of this muscle and make sure that we are treating it properly while that microbiome is being reconditioned. So there's different aspects we need to sit down and discuss with this individual, and assure them that as they're increasing in the type and quantity of spores, they're getting more and more benefit, but it's their body that may limit them as to how fast they can go. So it was fine to go back to the one spore, but you can help her also strategize in what other things she needs to do to be working out her gut muscle. And because as we know, it's just like with our own bodies. We can't just eat a healthy diet and expect all of our muscles to be conditioned well. We have to work out. We have to mind our stress, watch our supplements. So there's a whole plan that has to go into action on this. Does that help you with any strategizing for her?
Yes, it definitely does.
Super.
Okay, I have a question regarding taking the Mega Mucosa and the Mega Prebiotic. I have a person who's restricted on fluid. Um, Can they sprinkle the mega mucosa and the prebiotic on their food, or does it have to be in water first?
No, they can mix it into applesauce, if they, you know, depending on how the taste is on whatever food they're mixing it with. It really, there's no requirement that it has to be in water. That the idea is we've got to figure out just how to get it inside their gut. So they want to be creative in that aspect. That is perfectly fine.
Okay, I just wanted to make sure, like, for example, if they were eating a sandwich, if they could like put it on the sandwich somehow. I don't know how, but if they could do that, that would be okay.
Yeah, I mean, I can see, they can mix it in the mayonnaise, and it'll might turn
Yeah.
pink or blue, depending on what the colors are in the product, but it's not going to affect how it's going to work in the gut.
Okay. And then the prebiotic in the capsules.
Mhm.
3 is equivalent to about a half a scoop, 6 is equivalent to a whole scoop. Um, hmm, now, I haven't tried it myself, but could you open up the capsule into powder form and there's no taste again?
It's going to be a
Or
nasty
less
taste.
sweetness at least?
Well, yeah, it's less sweet. It has no flavors. There's no citric acid in it. Um, and if you can disguise that in something, you can certainly, open the capsules and put it in something. Just be aware, it's going to taste nasty. That's why it's in the capsules, to avoid someone being able to taste it.
Mhm. Okay. Because I have somebody that's allergic to mangoes and poison ivy, and the other one has a mango flavoring, so I thought this would be a good option.
Exactly. I have a off-label, and
Alright, sounds good.
I don't remember if I've brought this up in past sessions, but I did have a practitioner who's had a patient who'd been struggling with MRSA on their skin for a very long time. And the patient actually did some research online and found that if you spray bacillus spores directly on the skin, that it has a positive effect. And when he brought that information to her, of course, she said she just happens to have a source of bacillus spores, and gave him the HU58. He was following a protocol that he found online, and she actually sent me that paper, which was basically putting it in a kind of a spray bottle that he could spray on his skin, and the MRSA cleared up, and he's not had any issues with it. So I think it's great that patients and practitioners are looking for other ways to use these spores. In past, as a practitioner, I would always look for transdermal type of um, you know vehicle to enter the body, to do a protocol where I could do from the inside out. Of course, giving them still the supplements, the spores orally, but also what other things can we do with that local microbiome? Is it spray, make it into a lotion, put it into a gel? I mean, this is basically what compounding pharmacists do, is figure out different modes to deliver a payload of products. So it's great to get creative, and just know that there are other people out there creating, nasal sprays and skin sprays and suppositories, and just using these spores in all sorts of creative ways.
What do you think about putting the spores on for eczema?
I would give it a shot, because the skin has its own microbiome, and we don't expect the spores to colonize on the skin, but we are very well aware of the aspect of quorum sensing. They have chemical surveillance system, and so do other bacteria. So when these other bacteria sense that these spores are in their environment, they many times move out because it's like, criminals sensing that the police have moved into town, and they take off because they know they're not going to be able to resist the defenses of the spores.
Okay, sounds good.
So in a healing aspect, if the skin has a condition, many times the immune system of the skin in that area will be affected, and it will attract candida, MRSA, and other pathogenic, because the skin condition, whether it's eczema or psoriasis, is changing the immune system in that area. So the spores will help basically keeping those predators at bay so the skin has a chance to heal. So especially if you're dealing with the gut, the main GALT part of the immune system, you're helping in two different areas.
Sounds good. I might give it a try and see what happens.
Excellent. Okay. Well, can you think of any other questions, comments, or additions? If not, we can go ahead and wrap up. And I wish you all the very best rest of your Thursday. And then tomorrow you can welcome in Friday for the end of the week, and have a great weekend. Take care.
Thank
So
you.
long.
I have no more questions. Goodbye.
Bye-bye. Take care.